Imagine this. You've spent more than 70 years building a life, raising family, surviving heartbreaks, celebrating wins. You've earned every grey hair and every laugh line. Yet the moment you sit in a doctor's office at 71, 75, 80 years old, you're often handed a checklist of tests just to be safe. No one asks about your priorities, what you want from the years you have left, or how much you're willing to risk to keep your independence. They just hand you the protocol and expect you to say yes. But what if that protocol could actually hurt you? What if some of those routine tests didn't just waste your time, but put your health and freedom at real risk? That's what too few people talk about. As you age, your body doesn't react the way it did at 40. Healing is slower, sedation lasts longer, dehydration hits harder, and fear itself can be devastating. But our healthcare system wasn't designed with those trade-offs in mind. It was designed to find everything it can, whether or not it actually matters for you at this stage of life. Today, I want to talk honestly, even urgently, about 5 specific health tests that so many people over 70 are pushed to take. Tests that can do more harm than help. Because this is not about ignoring your health. It's about protecting it in the ways that actually matter. If you care about your health or the health of someone you love, hit that like button so more people see this message. And if you want more honest, respectful, science-backed discussions about aging well, tap subscribe and turn on notifications so you don't miss the next time we sit down for a real conversation. This isn't fear-mongering. This is about taking back your right to make informed, thoughtful choices about your body, your time, your independence. Let's start by getting clear on why this matters so much. Our culture is obsessed with testing. Catch it early, they say. Stay ahead of disease. But they rarely mention the other side of the coin, the trade-offs. After 70, those trade-offs become much more serious. Sedation isn't trivial anymore. It can linger in your body, causing confusion or delirium. Dehydration from bowel prep can be dangerous. Falls can be catastrophic. The anxiety from being told something is abnormal can rob you of sleep, energy, and joy. And worst of all, many of the things these tests find would never have hurt you in your lifetime. But once they're found, the medical machine kicks in. More appointments, more scans, biopsies, surgery, hospital stays, recovery you may never fully bounce back from, all for something that might have remained silent forever. I want to be clear, most doctors aren't malicious. They're doing what they were trained to do, find disease. But medicine is slowly waking up to the fact that this approach doesn't always make sense for older adults, especially for those of you who want to prioritize quality of life over chasing every possible problem. So let's look at the first test that deserves a hard, honest conversation: the colonoscopy trap. Colonoscopy has been hailed for decades as the gold standard of colon cancer prevention. And in your 50s or early 60s, it really can save lives. But after 70, especially if you have no symptoms and no family history of early colon cancer, the balance of risks and benefits changes dramatically. Most people don't understand what a colonoscopy really demands. First, there's the aggressive bowel prep, drinking powerful laxatives that flush your entire system. That can cause severe dehydration and dangerous electrolyte imbalances, which are much harder for older bodies to recover from. Then there's sedation. Your liver and kidneys process drugs more slowly as you age. The sedative effect can linger, leaving you groggy, confused, at real risk of falling and seriously injuring yourself. And the procedure itself isn't risk-free. There's the chance of perforation, internal bleeding, infection. But even if you sail through the procedure, there's the bigger risk no one talks about: finding something. Most polyps grow so slowly that they'd never become cancer in your lifetime, taking 10 to 15 years to turn dangerous. But once a polyp is found, fear takes over. You're told you need repeat scopes, biopsies, maybe even partial bowel removal. Suddenly, you're on a medical treadmill you never asked to board, all in the name of prevention that may not extend your life at all and could easily reduce its quality. Consider the story of Bill, who was 84 and still sharp, independent, loved tending his garden. His doctor insisted he was overdue for a routine colonoscopy. During the prep, Bill became severely dehydrated. He fell getting out of the bathroom at night, hit his head, and ended up in the hospital for 2 weeks. And what did the colonoscopy find? Nothing. He risked his independence, his safety, and his dignity for a test that did him no good at all. This is not an isolated case. Older patients are at much higher risk of post-operative cognitive dysfunction, a fancy phrase for confusion, memory loss, or brain fog that can last weeks or months after sedation. Even many medical associations now advise, if you're over 75, have had previous clean screenings, and have no symptoms, routine colonoscopy may not be necessary at all. Instead, you can opt for non-invasive stool DNA tests. These tests don't require sedation, bowel prep, or dehydration. They're safe, easy, and effective for many seniors. This is about informed choice, knowing your options, weighing real risks against real benefits. And look at what real viewers have said. I'm 85 and my doctors call me uncooperative because I refuse these tests, said Linda. I'm 79 and told my doctor I don't feel sick. I declined the complete checkup. Attitude is everything, shared Giselle. My children keep pushing me to get tests. I dug in my heels and refused. This video reassured me, wrote Dorothy. These are real people taking ownership of their health decisions. They aren't being reckless, they're being thoughtful. Of course, colonoscopies can still be important. If you have new symptoms like rectal bleeding, unexplained weight loss, persistent abdominal pain, or a strong family history of early colon cancer, then yes, you should consider it. But if you're healthy, with no symptoms, no family history, and prior clean tests, you have every right to say, no thank you. This is about dignity, about choosing the kind of aging you want. Now let's talk about the full body scan mirage. It sounds so appealing, doesn't it? Let's scan your entire body, find problems early, stay ahead of disease. It's marketed as peace of mind, but for seniors, it often delivers the opposite. Full-body CT or MRI scans are not routine screening tools for healthy older adults for a simple reason. They don't know how to tell what matters from what doesn't. They pick up every tiny nodule, every shadow, every harmless abnormality that would never have caused you harm. But once it's found, panic sets in. Doctors can't ignore it. Now you're sent for biopsies, surgeries, more scans. Each step brings new risks, new stress, new costs. I want you to meet Betty, who was 79, healthy and active, walking daily, feeling great. At a health fair, she saw a mobile clinic offering discounted full-body scans. She thought, why not? Better safe than sorry. The scan found a tiny lesion on her kidney. Her doctor tried to reassure her it was likely harmless, but she couldn't sleep, couldn't stop worrying. She demanded surgery to remove it. The surgery was grueling. Recovery was long. She lost mobility and confidence. And that lesion, it was benign. Nothing. She traded independence and well-being for fear. And let's be real, biopsies in older adults are not simple. They carry more risk of infection, bleeding, or complications. Surgery is harder to recover from. Even lying on a hard table for 30 minutes during a scan can be painful for arthritic joints, and it's rarely covered by insurance unless medically necessary, leaving many seniors paying out of pocket to buy not peace of mind, but an endless cycle of testing. These aren't hypothetical dangers. Listen to real comments. So many appointments and tests for nothing. I was exhausted, said Cheryl. My doctor wants another MRI even though I have no symptoms. I'm cancelling it, said Karen, age 75. I went through hell since April. "I'm about done," said Mary, 72. These are real people describing the hidden cost of over-testing. That doesn't mean scans are evil. There's a time and place for them. If you have new, unexplained symptoms, if your doctor believes imaging will truly change your treatment, if it's a targeted scan to answer a specific question. But the blanket approach of, let's scan everything, is not care, it's fear, and it often backfires. If you're over 70 and healthy, you have the right to ask your doctor, will this test really change anything about my care? If the answer is no, you have the right to say no. Because saying no isn't neglect, it's wisdom. It's protecting your time, your energy, your clarity, and your dignity. After 70, better care often means fewer tests, not more. Fewer false alarms, fewer invasive procedures, less anxiety, more energy to enjoy your life. In the next part of this video, we're going to talk about another test that so many seniors are pushed into, the cardiac stress test. We'll discuss why fear of heart disease can lead to dangerous overtreatment. We'll share real stories of people who went through these procedures and paid the price. And most importantly, we'll keep giving you practical, respectful alternatives to stay safe and informed. Let's pick up where we left off. If you've stayed with me this far, you already understand that more testing doesn't always equal better care. This isn't about ignoring your health, it's about respecting your age, your body, and your priorities. But there's another area where the medical system often fails seniors, the heart. We all know heart disease is serious. It's one of the leading causes of death. So doctors, often with the best of intentions, want to test you just to be safe. But here's the problem. Many of the tests we use to assess heart health in younger people can be misleading and even harmful for those over 70. Today, we're going to focus on the cardiac stress test. We'll discuss how fear of heart disease can lead to a cascade of procedures you never needed, with real risks to your life and independence. Because at this age, the goal isn't to chase every theoretical disease. It's to stay strong, independent, clear-minded, and able to enjoy your time with family, friends, and the world you've built over decades. If you're someone who wants to stay informed about aging well and avoiding unnecessary harm, please take a moment to like this video so more people see it. And if you haven't yet, subscribe for more honest, practical discussions. This isn't about fear, it's about empowerment. Now let's dive in. The cardiac stress test sounds like common sense. After all, heart attacks seem to come out of nowhere. We hear stories. Someone seemed healthy, went for a walk, and collapsed. That fear is real, and doctors know it. The logic behind the stress test is straightforward. Push your heart under controlled conditions and see if it struggles. For decades, it's been a standard screening tool, but after 70, your body changes in ways that make the results far less reliable and far more likely to mislead you into dangerous, unnecessary treatments. As you age, your arteries naturally stiffen. Blood pressure varies more. The electrical patterns in your heart can shift. None of these changes necessarily mean you have heart disease, but the stress test can't tell the difference. It just sees something unusual and raises a red flag. That's what doctors call a false positive. And then what happens? You're scared. Your doctor is worried about liability. So you're sent for further tests, angiograms, catheterizations, stents, maybe even bypass surgery. Each step has its own real risks: bleeding, infection, kidney damage from contrast dye, dangerous drops in blood pressure. And let's be honest, surgery at 75 or 80 is not the same as surgery at 45. Your body doesn't bounce back the same way. Recovery is longer, complications multiply. Consider George, age 75. He was retired, still driving himself everywhere, loved playing with his grandkids. No chest pain, no shortness of breath. He went in for a routine physical and his doctor said, "Let's do a stress test just to be sure." The results were borderline, just enough to worry the cardiologist. Next thing George knew, he was on the table for an angiogram. They found mild, non-obstructive plaque that wasn't blocking blood flow but could be a problem one day, so they put in a stent anyway. After the procedure, George developed a serious infection at the catheter site. He ended up in the ICU. He spent 6 months in and out of rehab facilities. He lost his independence, and all of it started with a stress test he didn't need. This isn't just one sad story, it's a pattern. Many respected cardiology associations now warn against routine stress tests for seniors who have no symptoms. If you're not having chest pain, unexplained shortness of breath, or fatigue during activity, there's often no benefit and significant potential harm. That's because the stress test doesn't accurately predict your risk of a heart attack at this age. It doesn't reduce mortality. It often just leads to a cascade of invasive procedures for something that might never have caused trouble. We can't forget the psychological toll either. Your heart isn't just a muscle. It's a symbol of life itself. When someone tells you there might be something wrong with it, fear takes over. Seniors in the comments have shared stories that are heartbreaking. Pamela talked about her late husband, forced to run too hard during a stress test at 70, who collapsed on the treadmill and died. Ken shared how his father was pushed to get a stent at 90 for a suspected aneurysm and never made it home. Frank said he was told to get all these tests, but he said no. He's 80 now, living alone, healthy, and happy. These aren't just numbers. These are real lives, real families, and for every George, Pamela, or Ken who shares their story, there are countless others who suffer quietly. Good doctors know there's a difference between treating people and treating numbers. More and more geriatric specialists are telling their patients, after 70, healthcare needs to be more personal. The goal isn't to fix every little thing that shows up on a test. It's to help you stay active, clear-headed, independent, and joyful. That might mean choosing not to do a stress test just because it's available. It means having an honest conversation with your doctor about your symptoms, your goals, your fears. Because the truth is, healthy aging isn't about hunting down every possible disease. It's about living well with the body you have. So when should you consider a stress test if you have new chest pain? Shortness of breath doing activities you used to do easily, unexplained fatigue or dizziness. These are real warning signs that need investigation. But if you're feeling good, walking daily, sleeping well, no symptoms, you have every right to say, let's wait. This isn't reckless, it's wise. Look at the real-life voices that prove the point. Joe is 82, with excellent blood pressure, still doing resistance training 3 times a week, refusing to be someone's science experiment. Sylvia, 83, says her doctor yelled at her for not taking a cocktail of drugs she didn't want. She eats plenty of vegetables, feels great, and refuses to be treated like she's on death's door. Mona, 84, described how her primary care doctor sent her for stents and put her on 15 medications. She spent most days in bed, lost her strength, and now she's fighting to get off the unnecessary meds and reclaim her life. Even some doctors in the comments admitted the truth. Dr. Valana, a retired physician, said bluntly, "They don't like it when you say no." Dr. Senior Health Tips, 02, a geriatrician with 30 years of experience, shared that he always tells his patients more testing isn't always better. False positives can lead to anxiety and dangerous procedures. Medicine is evolving, but you shouldn't have to wait for the entire system to catch up. If you're over 70, think carefully about what really matters. Is it living forever or living well? Do you want to spend your time bouncing from test to test, worrying about every little abnormality, or do you want to spend it enjoying your family, your hobbies, your faith, your friends? Because every test you say yes to has consequences, not just medical consequences, emotional, financial, and lifestyle consequences. You deserve to know that. So here's what a better approach looks like. Have open conversations with your doctor. Ask, Will this test change what we do? Focus on your actual symptoms, not just numbers on a chart. Prioritize movement, nutrition, sleep, connection. Embrace thoughtful observation over aggressive intervention. This is not neglect. This is wisdom. In the final part, we'll continue this conversation. We'll talk about the dangers of simply repeating tests automatically, the push for one-size-fits-all medicine, and how you can push back respectfully. We'll share more powerful real-life comments from people who chose to step off the medical conveyor belt and live on their own terms. And we'll close with a call to rethink what health really means in your 70s, 80s, and beyond. If you've stayed with me through the first two parts, you already know this isn't just about tests or procedures. It's about something much bigger. It's about how we treat older adults in our healthcare system, about whether we see you as a person with history, wisdom, and goals, or as a box to check off on a protocol sheet. We've talked about the colonoscopy trap. We've talked about the full body scan mirage. We've explored the hidden dangers of cardiac stress tests that lead so many seniors into unnecessary procedures. But there's another danger lurking in our system that needs to be discussed. It's not any single test. It's the habit of repeating tests automatically without asking if they're still necessary. It's the one-size-fits-all approach that ignores what actually matters to you. Because let's be honest, medicine often treats age like a disease. You turn 65 or 70, and suddenly you're told to get on the routine testing treadmill. Even if you're feeling great, doctors may schedule the same tests over and over, year after year, simply because that's the rule. Not because you need them, not because they'll help you, but because it's what the system says to do. But you're not the same as you were at 50. Your body isn't the same. Your risks are different. Your priorities are different. Maybe you're more focused on staying independent, clear-minded, avoiding hospital stays, avoiding falls, and spending your days doing what you love. Yet the system rarely asks you that. Too many older adults feel pushed around, treated like children, told, just do this, without any real explanation. And let's be honest, many seniors have told us they're scared to say no, afraid they'll be labelled uncooperative, dismissed, even scolded by their own doctors. Just listen to the real words from viewers. One woman shared that her doctors labelled her uncooperative because she refused these tests, even though she was 85 and healthy. Another said her children keep pushing her to get every test, and she had to dig in her heels and refuse. She said watching this video reassured her that it's okay. This isn't just about the tests, it's about agency. About your right to decide what happens to your body. About making sure medicine serves you instead of the other way around. Because the truth is, repeating tests automatically can be dangerous. Take colonoscopies, for example. We've seen too many people in their late 70s or 80s who had multiple clean colonoscopies already, but whose doctors said, let's just do one more to be safe. No symptoms, no family history. But the protocol says it's time, and what happens? They endure sedation, bowel prep, dehydration. They face a higher risk of falls. They risk perforation, all for a screening test designed to catch a cancer that typically takes 10 to 15 years to develop. Eileen, 79, shared her story in the comments. She had a clean colonoscopy at 68 and 73. But at 78, her doctor pushed for one more just to be safe. During the procedure, they perforated her colon. She needed emergency surgery. She spent a month in the hospital. She survived, but never got back her old energy, never felt as independent again. She said, I wish someone had warned me. We need to stop acting like just in case is always worth it. And it's not just colonoscopies. Stress tests are often repeated over and over, even when there are no symptoms. Doctors sometimes say, let's see how you're doing this year, without asking if you're even having any trouble. But if you're walking every day, living your life, feeling fine, what are you really testing? What are you willing to risk? Because that stress test might lead to an unnecessary angiogram, a stent, blood thinners that increase your risk of bleeding, medications that sap your strength. Mona, 84, said her doctor put her on 15 medications after stents. She spent most days in bed, lost her strength, lost herself. She had to fight just to get her old life back. So why does this keep happening? Part of it is habit. If something worked at 50, doctors assume it must still be good at 75. But aging changes the math. The risks go up, the benefits go down, and that means the equation has to be recalculated. Part of it is fear. Doctors are afraid of missing something, afraid of getting sued. Patients are afraid of what might happen if they say no. Family members, with the best intentions, push parents and grandparents to do every test, just in case. And part of it is the system itself. Our healthcare system rewards procedures. It pays for testing. It doesn't pay for long conversations about goals, values, and trade-offs. But you don't have to accept that. You have the right to ask questions. You have the right to say no. You have the right to have a doctor who listens to you. A better approach isn't about ignoring your health. It's about respecting it. It's about being thoughtful instead of automatic. You can ask your doctor, if this test finds something, will it change how we treat me? You can ask, what are the risks of this test for someone my age? You can ask, do I even have symptoms that justify this? And you can ask, what would happen if I just watched and waited? Because sometimes the bravest, wisest choice is to do less, not because you're giving up, but because you know what really matters. It's not about living forever, it's about living well. Living well might mean spending your mornings gardening, walking with friends, cooking for your grandkids, going to church, sitting quietly with a good book, laughing with people you love. It means avoiding weeks in a hospital bed, months in rehab, avoiding confusion from sedation, avoiding the emotional weight of unnecessary diagnoses. Your health isn't just about numbers on a test. It's about your independence, your energy, your comfort, your joy. This video and this series exist to say something that needs to be said more often. You're allowed to question the system. You're allowed to say no. You're allowed to ask for care that is personal, respectful, and adapted to you, not to some generic protocol designed for people half your age. Because growing older doesn't mean growing helpless. If anything, it means you're finally wise enough to know what matters. So here's what I want to leave you with. Know your options. Ask hard questions. Focus on symptoms, not just screenings. Prioritize what you want for the rest of your life, and don't be afraid to say no. If you found this helpful, please share it with someone you love. So many seniors are quietly struggling with these choices, feeling pressured, feeling dismissed. Your share might be the thing that helps them see they have options. And if you want to keep having these real, honest conversations about aging well, conversations no one else seems willing to have, please like this video and subscribe so you don't miss the next one. Because your health isn't about tests, it's about you. You've earned the right to live these years on your terms, not fearfully, but thoughtfully, not overloaded with procedures, but empowered with knowledge, not constantly preparing for sickness, but actively creating a life of meaning, joy, and connection. Thank you for spending this time with me. Take good care of yourself, and remember you're not alone. We're all learning how to do this better together.